Okay, I'm going to talk about basic dentistry instruments that everybody needs for a surgery pack, and this is what I typically use. I like to have a round scalpel handle, and the reason I like a round one is I have better dexterity with it, and I take and use it to make a series of small stab incisions, and I can be very accurate, and I can rotate the scalpel handle with my thumb so I can place the blade exactly where I want it. So that makes the incisions in the gingiva much easier. Then I'm going to go with a Periosteal elevator, and there are a couple different types. This is a Molt 2.4, and then this is a modified Molt 2.4 and a modified Molt Mini. And so I would use this one probably the most, and they're both two-ended, and so I would tend to use this one more on feline and this one on dogs. I tend to use the smaller end mostly, and when you hold this instrument, you want to hold it with your fingertip up towards the instrument tip, and then as you use it, you have to get under the periosteum, because the whole reason you're doing this is to elevate the periosteum off of the bone. And so you engage in there, and then I lift the instrument about 25 to 30 degrees, and then I rock it back and forth as I'm pressing it underneath the periosteum, and then I'll lift, and then I'll keep advancing forward, and then I'll move to the side, and I'll do the same thing. But you have to get the palm of your hand up, or otherwise, if you go forward, you're going to punch through the gingiva, and you don't want to do that. So then the next instrument I would use would be a periotome. And so this is a double-ended periotome. It's straight on one end and it's curved on the other. And so I tend to use a single-ended one, and I use a 1.3 millimeter, and I also use a 2 millimeter. And what this does, it's basically a knife, and you're going to place it into the incision you made. So if the margin is diseased, then you make your incision up a little bit. That's where you place this instrument, and you're just going into the periodontal ligament space, and then you wiggle it forward as far as you can until it gets stuck, and then you pull it out, and then you find a different spot, and you just keep doing that, and as far as you can around the tooth. And it depends on which tooth you're doing. Sometimes you don't work around the whole tooth, but you just get as much as you can, because the more you cut, the less that you have to fatigue later. And so I tend to call it like using a steak knife and just driving it to cut the gingiva. Then I'm going to use probably some type of a luxator. So there are a couple types. So these are both 4 millimeters. This one is called the GerMedUSA, and it's a flatter luxator. This one is it's called a WingLux, and it's kind of a hybrid between a winged elevator, which would be like this. So it's a combination. It's kind of like if these two had a baby. And so it's sharper, and it's a little bit more fragile. So you don't really want to use either of these instruments for prying very much. They're more for cutting the ligaments. So they just continue the work you did with the periotome. And then you're going to use the elevator at the final step to press against the tooth in the periodontal ligament space, press that tooth against the opposite alveolar wall, and then that will be your final loosening. So there are several different options in here. You just have to make sure you're using the right instrument for the right thing, because you don't want to pry with your more fragile instruments. So there's a variety of sizes. They're usually sized from 1.5 to 6, and so you find the right one that fits the tooth that you're working on. Then once you get the tooth loose enough, then and only then do you use forceps. And these forceps do a better job of grabbing the tooth than a lot of the forceps I've used. And really the forceps, if you're putting a lot of pressure and having to pull a lot, you need to go back and either use the periotome some more, or the luxators, or elevate some more and get it loose. This is really more of a catcher's mitt. Then in the instance that you fracture a root, then you're going to use burrs and also some smaller luxators. So here's the type of luxator that I would use. This is a straight one. It's made for feline. You can take a small burr and burr and make a moat around that root, and then you can use the luxator. And once you get it loose enough, then you need something with fine enough tips like these peat root forceps, and they come in different angles. I prefer this angle here that you can see, and they can get in there in a very small area and pull that root tip out. Then I'm going to suture, and so I have to also prep my flap. So I like to have 2 pairs of scissors. These are the Lagrange scissors, and these are Goldman Fox. The Lagrange scissors I like to use just for my soft tissue. So if I'm trimming up the edge of my flaps, that's what I'm going to use. I don't want to use this for sutures because sutures will dull your scissors. So that's where I would use the Goldman Fox. Or if I have some heavier gingiva that I'm cutting that may have some periosteum on it, then I'm going to use those scissors. But I want to have 2 different ones, and I have one pair that I take very good care of and one that I still take good care of, but I'm willing to use it for some heavier things. Then the next step would be to suture my flaps, and I prefer to have a pair of curved needle drivers and I like a fairly short pair, and that curve will get you around the corner in some very tight areas that you can't get to with straight needle drivers. Then for my forceps for holding my tissue, these are carbide tipped, so they're similar pattern to like a Brown Adson, but they have the carbide insert, so you can use them to drive needles in tighter places. But where I use them the most is just for a general tissue handling forcep, because they're about the least traumatic thumb forcep that I've found, and so they don't tear my flaps up as bad. And then just one other instrument that I use, and usually it's when I get to the suturing part, would be a lip retractor. And this just clips onto the lip, and I just flip it over. Sometimes I have an assistant hold it so that they can hold tissue out of the way. But a lot of times, especially towards the front of the mouth, I can just lay it over and it will hold it open, and that way I don't have the lip in my way as I'm trying to suture everything. So that's just kind of a general overview of the instrumentation that I like. And so you just need a variety of instruments, and the important thing is you need to make sure you're using the right instrument for the right job.